All right, so I've had my surgery. What am I? It's the 21st today, and I had my surgery on the 3rd, so I'm doing pretty good. It was major. It was 394 minutes of surgical time according to the operative report. So it was 7 pages long. 6 pages of it was the hardware that they put in my foot. They had a real hard time getting some of these bones over here sorted out because they're all crushed, so they couldn't get them into the right position. They used a ton of K-wire, and there's 4 plates over the metatarsals, and these what the heck are they called, cuneiform bones and navicular bones. They've had to fuse a number of them, but yeah, I've lost just a staggering amount of muscle off of my shin. It's like hard to fathom. Like I've lost everything. Like it's just gone. It's a weird thing. I mean, psychologically, that's actually probably the hardest thing. Go figure. But yeah, as far as the surgery is concerned, it went well. I was awake for it. They did a spinal and a nerve block, but the nerve block that was not good after the surgery. I ended up just in excruciating pain. They said it was what they call a rebound nerve pain, caused by the nerves just kind of waking back up. But yeah, so it was a Wednesday that the surgery was on, and that nerve pain didn't settle down at all until about early Friday morning. And I mean, it was excruciating, like 1,000 times worse than the normal baseline post-op pain that would accompany a surgery like this. So from that perspective, it was a rough surgery. Once that settled down, it was fine. Like, I mean, it's sore, but I managed, no problems. Anyways, back to where I was. I had an interruption there, so hopefully it doesn't screw my train of thought up too much. But anyways, yeah, so after that nerve pain settled down, what I would expect as normal post-op pain was present, and I was off all the painkillers by Friday. Well, technically, no, it'd be Saturday morning, so not Friday night, but by about 1 or 2 in the morning, which would have been a Saturday, I was off of all of the painkillers, and I've kept my foot up, and it's been pretty good ever since. The biggest risk for the infection processes and stuff was, I was told it was, my littlest one here keeps trying to be in the video, and I've had to explain to her that this is not a video of kids. It's on my foot. But anyway, so yeah, the biggest warning the surgeon gave me with respect to controlling was with respect to controlling swelling, because that is a big driver of infection. If the swelling isn't managed, wounds can open up and not heal properly. And I've been really lucky. I've been really good. My diet and nutrition is really good. Besides, being on a carnivore diet, I'm taking other supplements. I'm taking SAMe, magnesium, potassium, copper, zinc, collagen every day. So I'm taking a lot of stuff like that to try and help give my body everything it needs to do what it needs to do. I've also been putting like a comfrey salve on the bottom of my foot. Comfrey has long been known as knit bone. Yeah, so knit bone. It's got some compounds in there that are known to increase cellular growth and stuff, speed up healing, and also they're very anti-inflammatory. So with that being said, I think I've done a pretty good job in keeping the inflammation down to a minimum. I mean, I'm still dealing with a lot of swelling every time I get up and go to the bathroom. There's a lot of pain from the blood pump down to my foot. But other than that, very stiff. I've got some exercises I was told to, you know, try and move my foot around like this. I can't obviously put any weight on it. I've got to be very, very careful. I have an air boot now. I was in a half cast for just over 2 weeks there until I saw the surgeon, the follow-up. So during the day when I'm sitting here, I keep it out, and I'm wiggling my toes. I've also, I've got a TENS/EMS machine, so I'm putting pads here to here and trying to activate my calves and also over here, because I don't have a lot of feeling in my toes right now, and a little bit more at my big toe than my next toe over there, my middle toe. I've lost so much muscle on my calf and shin and everything. It's like staggering. Like, I mean, I don't know if you can see that, but it's crazy. And the muscles just aren't waking up yet. So with the TENS machine there, I've got some muscles firing in here, hopefully allow me to, you know, wake those muscles up and start stretching. You know, gently trying to manipulate my foot as well by like holding it like this and just rotating the ankle, because I can't do it with the muscles yet. So I've had a fair bit of experience with physiotherapy on knees and shoulders and stuff like that, so I've got a pretty good understanding of you know, ligaments and stretching and what they're supposed to feel like and what they're not supposed to feel like. And you know, I don't think I'm going to hurt myself or I'm going to put any stress on the bones. I'm supposed to curl my toes. I can't really curl my toes much right now. Very, very stiff. But in terms of the surgery, like I had it done at a place like the top foot and ankle surgical center in Vancouver called Footbridge. I was told by 2 other surgeons that they were the only place in my province that was capable of dealing with an injury of this severity. The surgeon, you know, before the surgery said it was extremely bad. I asked him, you know, had he ever done any similar, you know, in terms of the severity and whatnot. And he said, well, maybe 2 or 3. And then after, you know, the surgery was done, he said it was even worse than he initially expected. And when I saw him at follow-up, I asked him, I said, so is this the worst, you know, you've ever done? And he goes, yeah, you really did a number on your foot. I said, well, have you had any that are similar? And he said, well, I had one guy that was probably close. And he said, yeah, I asked him, I said, how did he do? And he goes, well, I saw him at the 6-month mark, but I didn't get to see him after that. I guess he got himself in trouble with the law, but he said at the 6-month mark he was doing pretty good. I think he said he was even playing some volleyball. So we'll see. I'll show you the video I took of the staples, sutures being removed from the incisions, and also put in the pictures of the x-ray. I mean, it looks like I have a mechano set in my foot, and yeah, it's pretty impressive as far as how much hardware is in there. I've cruised the internet looking at x-rays and stuff of midfoot fractures and Lisfranc injuries, or I think that's what they're called, and I have not seen one yet that looks like it has as much jewelry in there as my foot. So yeah, so far so good. It's gonna be a long road, and keeping my foot up and trying not to go stir crazy, I think, is gonna be the trick.
No, it's fine. I mean, I just didn't do my hair today, but yeah, it's okay.
That's all right, me either. That's about 10 years past that point.
Yeah.
At least you look like you can grow hair. I can't.
No. It's all tattoo, man.
Yeah.
Yeah. I had it done. Like tattooed hair.
Oh, seriously?
It's called scalp micropigmentation.
You know, kidding.
Gives you like a hairline or something.
Convinced me.
Yeah, there you go.
No.
Yeah, it's a thing now because it's not technically it's not like a hair transplant, right? It's more. Just looks like you just had a shave, a nice like shave. Sorry,
That
buddy.
side
I know
definitely hurts.
it would a little bit just because of the area.
Yeah, more
It's not a
nerves.
lot-
there.
yeah, and there's not a lot of like soft tissue underneath, but should be almost done now, and then we'll focus on the.
Be a low-grade infection, and if your immune systems become weak a little bit, then it starts to act up.
She just thought that if it gets, she did say, you know, if I have a problem before that starts to get bad, just go right to your clinic and start the process, and we'll start at that point. But I want, she said they would have probably wait.
I like pulling stitches out.
Oh, do you work in the medical field?
No, I just work on myself.
Oh, really?
I pulled a pin out of my finger.
Oh
after
yeah, I mean the
surgery,
pin
too.
is like it's not a screw, so it's pretty straightforward. You just acts like a scaffolding, so you can easily remove it.
Yeah.
Suture is a little bit tricky because you don't want to be leaving anything there, right?
No. No, I had an infection in my finger after having it
Oh no, really?
fixed with pins.
Who did it?
Oh, it was over in Nanaimo years
Nanaimo,
ago.
okay.
Yeah. And then got an infection. It went in through the pin site.
Oh jeez.
It was a bit of a big deal.
Yeah, that's the
Antibiotics long.
because it's technically it's still kind of like exposed and open, right?
Yeah, it went septic. Like it caused me a lot of
Yeah.
grief. But the one pin was wiggly, and I phoned the surgeon.
And they just told you just pull it out.
No, I said it was wiggly, and he goes,
Leave
okay,
it?
leave it. And I said,
Yeah.
well, it's really wiggly. Like I could probably pull it out. He said, well, if you think you can pull it out, pull it out. And then I went to the cast clinic to see him a few weeks later to get
Yeah.
the other one pulled out. He goes, I'm pretty sure I put 2 pins in this.
Yeah.
I did your surgery, and I said, yeah. I said, you told me to pull it out. And he just laughed. He's like, I've never had anybody actually do that.
Yeah. I mean most people are a bit scared and
Yeah.
and